My name is Adam Schell, and I'm a board-certified orthopedic spine surgeon here at the Nebraska Spine Hospital. I grew up in central Pennsylvania, and I did my medical school in Atlanta, Georgia at Emory University, and then I did residency in Cleveland at Case Western Reserve University. And that's really where I got exposed to spine surgery in depth for the first time. Spine surgery is kind of an impressive specialty within orthopedics because patients are often really suffering when they come to a surgeon for advice. And what we can offer in terms of spine treatment can have a dramatic lasting effect on their quality of life. And that was kind of my first introduction to it, was in residency training. I was fortunate to have the chance to do fellowship training in Atlanta again at Emory University, where I got to dedicate a whole year to common and complex disorders of the spine. I was in Baltimore for a few years practicing. I was then invited to join the group here at Nebraska Spine Hospital. I've been in Omaha ever since. What I enjoy most about being a spine surgeon is really the dramatic change that you can have in a patient's life. And again, they come to us and usually it's in a very difficult portion of their life. They have a problem that they've been suffering with for a long time. Nobody is dying to go see a surgeon. They've been thinking about it and hoping that this problem goes away, and it hasn't yet. And so they'll come consult with us. Oftentimes there's a problem that's very fixable, very treatable. Patients will have stopped doing certain hobbies, they'll have stopped taking vacations, taking time off work, and when we are able to do a procedure or recommend a treatment for them, then they get those portions of their life back again. And that's really rewarding. Patients are really grateful, and it's kind of a privilege to be able to interact with somebody during that portion of their life. That's probably my favorite thing about it. For disorders of the spine, they can be really daunting. It's often quite confusing for patients. I think what's important to me when treating patients is to make shared decisions with them for treating their problem. And that involves educating them, kind of teaching them, well, what's going on? Like what is my problem exactly? And what are the different ways that these treatments can help me? And really taking the time to go over those things with them to allow them to make a good informed decision with their surgeon as to what the best next step is. A surgeon really needs to take the time to educate them and inform them and make the decision together with them. What I try to do with every patient is just take that time to counsel them and inform them, educate them, and make a decision together with them as to what the next best step is in their treatment. Oftentimes I find that patients are relieved when they kind of learn about their issue and they can understand why they hurt this way, why they have numbness or weakness. It becomes much less daunting, and it feels like something that they'll be able to get through with the right treatments to make sure that patients understand their problem, and that enables them to make an informed decision. My advice would be to be sure that you consult with somebody who is fellowship trained and has experience treating spinal disorders, because there are a large number of problems that are very fixable, that patients will have outstanding outcomes. I'll often see people who have a very fixable problem. It could be very quickly addressed, or it could have been treated a long time ago. Nebraska Spine Hospital, I think, is a very unique place to have a hospital where everybody from the receptionist to the physical therapist, the nurse, the surgeon, for everybody to be focused on spinal disorders and treatment of patients getting spine surgery is very unique. And there aren't many places like the Nebraska Spine Hospital in this country or in the world. It's unique that at the Spine Hospital, every patient that the providers are caring for is a spine surgery patient.